was born with an extreme case of craniosynostosis, which means all the bones in his head were completely fused at birth. He had no nasal airways, had trouble eating, and basically didn't sleep. After 20 operations, they've given him a fantastic airway, he sleeps well, eats well. Without the care and support that Kidz First have offered us, he really wouldn't have been here today. And without that care, we wouldn't have had the goodest little boy that we now have.
Kidz First is a great concept, looking after the youth of tomorrow and the Kiwis of tomorrow, and they do a great job out there. I've known people that come from Invercargill to go to the burns unit, and they just, they go that extra mile. Very special place, to be fair.
It's a hospital adapted to its unique population. That's why I enjoy working here. It's adapted to the acute illness we see in our population, the chronic illnesses, and it's adapted to the unique cultures we see.
The thing about Counties Manukau is we're probably the most needy population. Our kids get the sickest. We've got the poorest kids. We've got a really diverse population, very young population.
And in South Auckland we're seeing third world disease in third world proportions that shouldn't really be happening in a country like New Zealand. So you need a centre to deal with that, which is why we have a big hospital.
Kidz First offers such a fantastic, facility. They don't only look after the child who they're caring for, but they take such great care of the families as well. And it's the support that the staff give families that actually help you get through those traumatic times. Having this new facility has just made it so much easier and more doable for, parents. Being close to your children while, they're in ICU is just so important.
We are so happy and so grateful to be in our new intensive care facility. When we look at the things we can now do for families, for children, for our adult patients, we look at the equipment that we have, we look at the space, the environment, the light. Every time we do something that we couldn't do in the old unit, we're thinking, well, how come we can? And the answer is because we were sponsored, because the sponsors were generous. They gave to the ICU Appeal, they gave to the South Auckland Health Foundation, and we received, and our patients received. And we would like to just say thank you yet again for those donations and for that sponsorship. It's made a huge difference.
For many, many years we worked in this community and in the Manukau community, the broader Counties Manukau community, to really get some serious government funding in here to deal with some of our secondary health issues through Middlemore Hospital, which was completely under-provisioned, and really to lift primary health care in our community. And we were dealing with some really savage, some terrible health stats. And so to see South Auckland Health Foundation come in, supplement the government's work, particularly on building and working in such areas as Kidz First, intensive care units, HDUs, to see them supplement that work there around ward development, equipment provisioning, has just been fabulous.
It doesn't matter where you live in Auckland, we simply have to recognise that if we don't as a community address the social and in particular the health issues of South Auckland, our community is going to be the worse for it.
When you go out to Kidz First and see the quality of the staff, the dedication of the staff, and the need, it's apparent to anybody that this is a wonderful cause.
Because Middlemore Hospital, particularly the burns unit, services the whole of New Zealand. So here we are able to not just help the Auckland area, but actually kids from all over New Zealand, and in some instances outside of New Zealand, by putting money in to areas where equipment was desperately needed for improving the quality of life for Kiwis all over the country.
I'm delighted to be part of Kidz First and be an ambassador for them. I grew up in South Auckland. It's a chance for me to give back to my community. Children deserve the very best healthcare, and here at Kidz First they get that. They get brilliant facilities and they're ever increasing, and we're doing such a great job of adding to the community.
Well, the great thing about the South Auckland Health Foundation is that it's a real example of how hospitals and communities can be coming together. I mean, we're standing here in Kidz First, and one of the things that I find really very fascinating is that this is a place which is the future of New Zealand. This is the biggest obstetric unit in Australasia. It's got a massive growing Pacific community in particular, and it's really important that as the future of New Zealand is born and brought and treated here, that we have a really good link into our community, and the South Auckland Health Foundation help us do that.
The other thing I think it's worth saying is the partnership that we have. The three senior members of Kidz District Health Board actually on our board have meant that we've actually done things together. There's been no selective opportunity. This is something we've done together, we want to do together, we know what they want, and we've raised the money for it. And that result has been a remarkable partnership, which I believe is almost unchallengeable.
The Lion Foundation has been a supporter of the South Auckland Health Foundation and Kidz First in particular for more than 10 years. In my 20 years as chairman of the Lion Foundation, we've given away more than $500 million to grant recipients. But I think it'd be fair to say that the people at the Lion Foundation would rank South Auckland Health and Kidz First amongst the most worthy of our grant recipients.
I guess the thing that I really admire about South Auckland Health Foundation is not only their passion, their commitment, but the ability to direct the money that they're able to raise and receive into areas of significant immediate need.
We have poverty, we have overcrowding, we have families that are stretched to the limit, and that's not going to change. And in fact, that's going to grow. And we are already seeing that with how busy our paediatric service has become in the hospital generally and in the intensive care in particular. You could look at it that we see the worst illness and the worst situations, and they reflect what's going on in the community, and that is not settling down, it's continuing and it's going to grow.
Of course we'd like to be in a community where government taxpayer money funded all of our needs in health and education. As a community, we simply can't afford that. I don't think most New Zealanders realise how reliant we are on a private individual and corporate money to simply make our health and education system work.
We need to keep resourcing and supporting the acute healthcare needs of this population, the chronic healthcare needs, but also to research what is going on for these kids in rheumatic fever, chronic lung disease and all the other things that we have.
I think it's important to remember that Kidz First isn't just a hospital. We're also working out in the community alongside primary care, in schools, with WINS and other sectors. And we need to be doing that because if we don't, we won't be fixing the reason kids end up in hospital all the time.
So there are challenges coming at us that are there now and will intensify unless we're proactive, unless we are prepared to really put in resource and to work on our young population now to ensure that they come through in the very best of health.
The first 10 years of Kidz First have been substantially about providing operational funding from the Foundation's perspective. I think we all think now it's time to look at securing some long-term seed funding from which we can grow, which will give a longer-term security to Kidz First.
Kidz First has come so far in the last 10 years, but it's also really important to look to the future, and this fund really enables us to do that, because who knows where we'll be in another 10 years' time, and it's important that we look ahead and we make sure our children are given the very best healthcare possible.
I think as a responsible citizens, as a company that actually operates in New Zealand, we have that responsibility, and we have a responsibility that we work here and we live here, and we have a responsibility to put something back.
For any corporate that was thinking of making a donation to Kidz First, I think I could guarantee that they would not be disappointed with their investment.
If you've got a spare dollar, I don't think there's anywhere better you could put it into Kidz First. I think it's a good bunch of people out there, and they certainly need our help. And it's not for me to tell you what to do with your dollar, but certainly if I could sway you a little bit, I think it's a very good cause, because you never know when one of your children may need the services.
We've been extremely lucky as a family to have been able to receive the care from this fantastic unit. I hope the support continues to come in so that children in the future get to have the same care that we've experienced.